difference for room 329 for the Senate. We have for SB 397, we have myself as chair, and that's it. For the House,
Thank you, Senator San Buenaventura. For the House, you've got Mizuno, Bellotti, Yamashita as your co-chairs. We've got Garcia as your manager.
okay, for this one, I believe we have an agreement as to a CD1, which we gave everyone except that we do not have FIN or WAM release. So may we roll this over to tomorrow?
Right, just want to confirm the numbers. I've got 30 million general funds to pull down or draw down approximately 43 million in federal Medicaid funds. Is that correct?
Okay, I am looking at the human services. I don't have those monies
Okay.
for 397.
Right, moving forward, we should let
Yeah,
both
so
FIN
let-
and WAM
let-
know approximate amounts or the amounts so they know.
So show me where you got those monies, because it's not in any of my memos.
If you
Okay.
look at any of the House draft committee reports, should be in there. The House
Okay.
committee.
We do not have that.
Okay, we'll work with you.
So-
And I have been relying on Healthcare Association of Hawaii, along with the Department of Human Services, which I believe have the numbers the same. But shall we
Yes,
reach out to
Senate
them
would
and make
like
sure?
to see these numbers.
You got it, Chair.
Thank you.
Will do. Thank
So,
you.
and we're not going to be able to show that to WAM unless I see the numbers, okay?
Yes,
So
Chair.
tomorrow, April 26th, same
Yes.
time, same place?
Yes, 1:30 PM, room 329.
Yes.
Thank you.
Okay,
Thank you, Chair.
So for
Appreciate it.
SB 404 relating to hospital sustainability program, I have myself as chair, co-chair Senator Inoue, and that's it.
Thank you, Chair San Buenaventura. For the House, you've got Mizuno, Bellotti, Morikawa as your co-chairs. We've got managers Amato and Garcia.
Okay, this one we've got numbers. We have an agreement on CD1, but we don't have FIN release. And this one, the numbers I've got is 173 million for 24-25. And that's it.
Right. Appreciate the fact.
Is that what, and 173 million for 23-24?
Yes, I believe we have the same numbers, and should we get approval from FIN and WAM, we shouldn't put in committee report that no general revenue funds are used for this measure.
Yes, I agree. Okay, and yeah, we'll talk later on as the joint memo.
So at this point, I
we'll-
think we're in agreement with in principle of CD1. Shall we reconvene trying to get the release from FIN and WAM?
Yeah, to tomorrow?
Tomorrow's fine.
Okay, same place, same time.
Wednesday, 1:30 PM, April 26th. Got it.
Okay, so for SB 1473 relating to health, I have myself as chair, co-chair Senator Keoho Kalole, and that's it.
Thank you, Chair San Buenaventura. For the House, you've got chairs Mizuno, Bellotti, Kobayashi, and we've got managers Amato and Garcia.
Okay, we are still working on a CD1 on this one. I don't think we have an agreement. But we have, did you see the Human Services memo that they prefer the House version? You know, this one we need to talk more because there are two different sets of testimony, right? One for under the age of 21, which is a Daintree Disability Council. And Human Services wanted for ages 26 or younger, and Daintree wants it for 21 and older. So two different sets of population. So we need to talk about this some more. So can we roll this over to tomorrow?
Yes, definitely, Senator.
But I think we got at least the numbers, but we just need to know what population we want to target this bill for.
Right. I believe the Senate had the autism spectrum disorder, and the House added on fetal alcohol spectrum disorders.
Yes, but I don't think that's the disagreement. The disagreement is the population.
Got it. I think Co-Chair Bellotti wanted to say a few words.
Thank you, Chair. I also want to clarify, I believe that the House position is to basically require a study, whereas the Senate position was to do a pilot program. So we're not on the pilot program. I just want to clarify that. So
We have major differences. So do you want to do it for tomorrow, or do you want to do it 2 days?
Why don't we reconvene tomorrow, see how far we got? See if we can
Okay.
get closer to compromise.
Okay, so for this one, who's the lead chair, you or Bellotti?
I've got the lead on this one.
Okay, so I just want to know who I'm supposed to negotiate with. Thank you. Okay, are we done?
We're done. Thank you,
Okay,
Senator.
we are adjourned. Thank you.
Appreciate it. Good afternoon. Today's date, Tuesday, April 25th. A little after 1:40 p.m., we're in conference room 329. We are here for two bills, House Bill 314 and Senate Bill 1592. For House Bill 314, House Draft 1, Senate Draft 2, House Count Freeze, you've got Mizuno Kobayashi as your co-chairs, and we've got Amato and Garcia as your managers.
Okay,
Representative Aquino?
Thank you very much, Chair. Senate conferees are myself as chair, and co-chair Shimabukuro and Moriwaki as a member.
Thank you, Senator. For this measure, I think we're talking about it. We'd like to accept the Senate Draft 2 position. I believe the appropriation amount that we determined was $2 million. And I believe we did a proposed CD1, Senator Aquino.
Yes, we received it, yep. And we are in agreement.
Okay, so we're in agreement in principle. At this point, Senator, we just need Fin and Wham release. Is that correct?
That's correct.
Okay. Senator, shall we reconvene this, trying to get Fin and Wham release? If it's okay with you, Senator, can we reconvene Wednesday, April 26th at 1:40 p.m., same conference room 329?
Okay,
Thank you very much.
sounds good.
Oh, I'm sorry, yes.
Did you get the memo about what type of food?
We did. Before we, yeah.
Want to go over?
Yeah.
Okay.
Senator Aquino, I know, we got this last minute memo. I know you guys got it too. It's like the day of. You know, your thoughts on the memo and any feelings either way.
Okay,
What did,
so we can come back. We can
Okay.
come back
okay,
tomorrow. Yeah.
can do, okay.
Okay.
Thanks. Again, reconvene. I already stated the time, date, and place, so we're good on that. Thank you, Senator. Did you want to?
Okay, for the next bill, Senate Bill 1592, Senate Draft 2, House Draft 1, relating to the Senior Medicare Patrol Program. So for the Senate, it's myself as chair, co-chair Moriwaki, and manager Shimabukuro.
Thank you, Senator Aquino. On the House side, you've got Mizuno and Kobayashi as your co-chairs. We've got Amato and Garcia as our managers.
Okay, for this one, I believe we have a CD that's currently being drafted. So once we have that, we'll be sharing that with you.
Okay,
Okay?
thank you.
But-
This is also going to need Fin and Wham approval? or release?
Yes. And it will include the 3 positions that's in the Senate draft.
Okay, okay,
And I believe for the biennium, it'll be about $378,000.
okay.
Okay?
So shall we reconvene tomorrow?
Same time. Yep,
Okay.
1:40.
1:40, room 329. Okay, thank you very much, Chair. Appreciate it.
Okay, thank you. We're adjourned.
We just want to get them out.
Good afternoon. Today's April 25th, 2023. It's a little after 1:50 PM. We're in conference room 329. This is on House Bill 777, House Draft 2, Senate Draft 2. Your House conferees are Mizuno, Tarnas as your co-chairs. We've got Amato, Iligan, and Garcia as your managers. Senator Aquino?
Okay, thank you very much, Chair. And for the Senate, it's myself as Chair, and Senators Moriwaki and Elefante as co-chairs, and everyone's here.
Thank you very much. Senator, I wanted to thank you for working with me on this measure. The proposed CD1 reflects the Senate Draft 2 position on the bill. In addition, if members, everyone should have gotten a draft of the CD1. Page 8, and I agree with you, Senator, we should not just have a carve-out for HHSC. There are other state entities. We should respect that. So we have the language on page 8, lines 12 through 20, to allow the state, branches, subdivisions, semi-autonomous public bodies to conduct more extensive inquiries into an individual's criminal history for employment purposes than those permitted under this section shall prevail. So I think that's a fair thing to do. There are other agencies, no doubt, that will be affected by this. This also allows them to do a more extensive criminal background check if they have it in their rules or under the HRS. Our effective date would be upon approval. I did check with our House Attorney, Mark Morita. He replied back via email, an approved legal check will be issued upon the adoption of House Bill 777, Senate Draft 1 proposed. So again, I wanted to thank you, Chair. Really appreciate your help on this one.
No, I think we are in agreement.
We're in agreement? Okay, members, Senator, if it's okay, I'll take the House vote first.
Yes, please do.
Okay, thank you. This is for the recommendation to accept the CD1. So Chair votes aye. Co-Chair Tarnas.
Aye.
Representative Amato.
Aye.
Representative Iligan.
Aye.
Representative Garcia. Thank you very much. And Mr. Chair?
Oh, okay.
Yeah,
Oh, you
no,
want
you
to?
can take it. You can take
Okay.
it.
All right. And for the Senate, again, recommendation is to pass this as a CD1. Okay, I vote aye. Senator Moriwaki.
Aye.
Senator Elefante. Aye. Thank you very much. Recommendation is adopted.
Oh, we have a bill. Thank you. Thank you, conferees. Thank you. Thanks, everyone. First bill.
Thank you.
Thanks, Henry.
Yep.
Appreciate it, brother.
Good job.
Thanks, man.
Yep. And scoop.
Okay.
You want to get low?
Oh, we're now adjourned.
right, good afternoon, everyone. Welcome to the 215 Conference Committee. This is for SB 129, relating to minors, DHS, no-cost emergency shelter and related services. And for the Senate, we have myself as chair, Senator Shimabukuro. We have Elefante and Inouye co-chairs, and that's it then for the House.
Thank you, Senator. On the House side, you've got Mizuno, Tarnas, and Kobayashi as your co-chairs. We've got Representative Garcia as our manager.
Okay, so now we did do a little bit of discussion prior to this meeting, and we do have a CD1, and we will make sure it gets emailed to everyone, all the conferees. And basically what the CD1 is doing is we are deleting a provision that had been put in the House Draft 2, which still required that minors basically get referred to foster care and stay within the child welfare system. Taking that out, in order to continue to give these youth the flexibility that if they would rather go to these other alternative shelters, that they have that option. And that's for groups like RISE and many that have been very successful in reaching these children that are at risk and on the streets. And then the bill continues to remove the sunset on the previous act, I guess, and we made the date good. And so the chairs are good with this measure, and the youth advocates are good with this measure as well. And so what we're planning to do is reconvene tomorrow. Is there any questions or concerns of anyone?
Okay, Chair. Okay. Garcia, are you okay?
Everybody's okay? Okay. So then in that case, we will get the city, we're gonna have a memo drafted that Chair Mizuno and I will initial, and then
We'll
hope
give
that
that
the money
Senator
committees-
Inouye, because she's the
Yeah.
Money Committee representative.
Yeah, so we'll just get that memo, get the CD1 over to Wham and Finn, and then hope that they'll get released.
Appreciate
In
it,
the
Senator,
meantime,
and
so-
House Conferee's on board, so thank you so much.
Then we're gonna reconvene.
Very good. Okay.
Reconvene, Senator, reconvene tomorrow, Wednesday, April 26, 2:15 PM. Is that okay?
Yes. in
Same room,
329.
329?
Yes.
Okay, thank you,
All right.
Senator.
Thank you, okay.
Okay.
We're adjourned.
Good afternoon. Opening up our 2:30 p.m. conference committee on a series of mental health bills. We're starting first on House Bill 950 relating to assisted community treatment orders. On my side, it's myself and Chair Tarnas. On the House side, it's Managers Lamasau and Garcia. Senator, for your members.
For the Senate, we have myself as chair, co-chair Senator Rhodes, and Senator Shimabukuro is not here, is not present.
Thank you. Senator, we're working on a CD1, but I just wanted to kind of verbalize what that changes are in the on House Bill 950. It's going to adopt the provisions about extending the orders, ACT orders to 2 years. This is, of course, so that we can see and ensure that the treatment is being managed well and taking. Also, we are going to be adopting some other ACT provisions that have moved through this session, including the use of online hearings, the ability for the judge to set subsequent hearing dates for the petition, allowing people to participate in the ACT ACT process at other locations approved by the courtroom. Again, we've learned over the time of the pandemic that telehealth is a way for access to the courts and for mental health. Finally, we were going to insert some language that people who are interested in, or parties who are interested in filing an ACT provision may request the Department of the AG to assist with the filing. Again, these are all just efforts to ensure that the ACT process is more effectively run, and throughout session, these measures have been able to gain support. I will note that a conference memo came in from ACLU expressing opposition, but we continue to believe that the ability to use these ACT orders over time with the assistance of a team, truly a medical team that is working with the individual, will best help them to be able to integrate into the community. We are, of course, talking about individuals who need mental health treatment. They may need psychotropic medications, but it's more than just that. It's also mental health treatment and acute care, health care that they may be receiving at some of these providers who have sought this ACT process, for example, like IHS. So we are preparing that CD1. Chair, if I can have that for you tomorrow, and we can pass it over to you tomorrow at 2:30, is that something that you're agreeable to?
When are we gonna meet? So are you proposing that this conference roll over to tomorrow at 2:30?
Yes.
And you are not gonna give me a CD, my members are not gonna see a CD1 until that conference?
Our staff is actually drafting it now, so I will get it to you as soon as we can, but I can also pass it across the table tomorrow.
Okay, because in the discussions that predated this, we were talking about CD1, already a CD1. So are you making changes, different changes from the CD1 that we had previously been discussing? Because that is what I was prepared for, is the CD1 that we have been discussing all along, which I am showing to you.
Yes,
And so
I am.
is there going to be a different CD1?
It is because, Chair, there are some provisions in here that are also in Senate Bill 1492, and I just want to make sure that we have the changes that we need in here. And I will provide that CD to you tomorrow, or as soon as we get it from our drafting agency.
Okay, so my understanding, because I mean, you went on for 5 minutes as to what
Sure.
HB number 950 CD1 is. My understanding is basically, I did not know about the SB 1492 being added in. My note says that HB 1156, a number of paragraphs in HB 1156, which we are allowing to be deferred, is going to be added into HB 950.
Yes, the things that I just spoke about are HB 1156
Right,
issues.
which is the Attorney General doing the, preparing for the petition in the event that an interested party is for some reason unable to. And that is what we were prepared for. But regardless, we're not ready to vote anyway,
No,
right?
I actually
So-
have received the CD1 proposed that we would like to offer to you, based
Okay.
upon what I just communicated, and I can provide it to you and your members now.
Okay, that would be good. And that would be what we would be looking at for tomorrow.
Yes.
Okay.
Hold on, let me make sure.
So I'm gonna be canceling the one that I had previously thought that we were going to agree to.
Yes. And
Okay.
here are the ones for us to discuss tomorrow.
Okay, so hold on, let me go see who we got. So Senator Rhodes, and I'll hold on to Senator Shimoku correspondence. Okay, so for today, are we gonna be rolling over HB 950 to April 26th at 2:30 at room 329 to discuss the CD1 that you had just handed to us?
Yes.
Okay, thank you. Okay, so next one.
Um,
So next one is SB number 1492. Present with me is myself as chair. Excuse me, for some reason I lost my list. Myself as chair, co-chair Senator Rhodes, and that's it. For the House, it's
Okay.
relating to mental health.
On my side, we have myself, co-chair Tarnis, co-chair Takenouchi, and managers Amato and Matsumoto.
Okay, this one, we are still working on language and monies, I believe. Department of Health had given us a proposed CD1, and let's just make sure we understand the amounts of monies that we are looking at when we start filling it in. We are looking at, what, 3 full-time positions to Department of Health, and, I'm sorry.
Can I interject here, Senator?
Yes, why don't you interject
So I
amounts
believe
of money?
Senate Bill 1492 is about data collection and reports by DOH, and it does have language that authorizes the Attorney Generals to assist with assist with the initiation of the ACT orders, and then some other language. We did have initially some money requests in here for DOH to procure data collection software and then to have FTEs, 3 FTEs to do the data collection and analysis. We're going to move those funding requests into Senate Bill 1594 for a number of reasons. But one, most importantly, because we have a number of priority asks related to mental health. And so this bill, with just the request, the authorization to do data collection and authorizing AGs to assist with the initiation of ACT petitions has no money ask. And that's what we're looking at for Senate Bill 1492.
So I'm working on a CD1, and basically, the petition for the involuntary commitment, I believe that is no longer in SB 1492, but is added into HB 950. And yeah, that's our understanding too, is that there's not going to be a money ask, but basically require the Department of Health and to cooperate with the homeless coordinator to make existing database to be more robust. And I've already started working with the agencies regarding that as to the language needed. So there will be a CD1. We're just not ready for it just yet. Hopefully we'll get it to you by tomorrow, April 26th at 2:30, 329. So can we roll it over until that time?
Yes, we certainly can.
Okay, you're next.
Okay, House Bill 1442. This is relating to rehabilitation. On our side, we have myself, Chair Tarnis, and Chair Takenouchi, and on the, as manager, Representative Garcia on your side.
And on my,
For the Senate, it's myself as chair, San Buenaventura and Moriwaki as co-chairs, and Awa as a manager.
Okay, Chair San Buenaventura, I have circulated previously a CD1.
I'm sorry, Chair, and this one is Chair Rhodes.
Oh, Chair Rhodes, I apologize.
Think nothing of it.
Chair Rhodes, I have previously circulated a draft proposed of House Bill 1442. Thank you for your work on this. We really pared this down and focused on what we hope are going to be rehabilitation efforts that will be helpful for the mental health. The first part embodies the collaborative agreements between the judiciary, prosecutors, and PDs concerning Act 26 and the Miami-Dade agreements, where they're going to be hopefully doing better crisis intervention on the streets. Part 2 of this does not mandate the use of telehealth for 704 examinations. And finally, there are probation violation amendments providing for more mental health evaluation and treatment through the probation process. Again, there had previously been money requests in here for the mandated telehealth examinations, but for this measure, we are not mandating, but only authorizing the telehealth examinations for 704. I believe we circulated this. I know that there is some considerations for you folks to continue to deliberate on this. So can we roll this over to 2:30?
Before we roll it, can I just, normally it's only the chairs who are supposed to speak, but can we have a larger discussion about what's in what bill? Because it's all interrelated. So I don't know, I don't think I have any objection to your draft 1442, but I'm not sure what is where now. Can we just talk about that?
Certainly, of course.
And I don't have the CD1 of HB 1442.
Okay. One of us, can you get her one if you have one, or send it later?
I can send it later.
Okay. So we'll roll this one over, but let's talk about the rest of the stuff first, if that's all right with everybody. So 1440, so backing up a bill to 1492. So your intention, Chair Sanborn Ventura, is to put what in 1492?
1492 is the database collection.
Right, and it also has,
And it allows for the involuntary commitment, which is actually being done right now for the petition to ensure that continues. And in the event, I believe your concern was, in the event that that for some reason an ACT petition is denied, that there would be notice given to Department of Health.
okay, so you're gonna keep that in?
Yeah, I'm gonna keep that
Okay.
in.
Okay,
That's my understanding.
all right, so then
But-
I'm sorry.
Yeah, but I'm looking at House Chair to see whether or not she's in agreement, but that was our understanding, was that the
Okay,
notice
but
to.
we're gonna leave the AG, the requirement that the AG has to assist in there as well?
Yes,
Yes,
because the
yes.
AG does the involuntary commitment now anyway.
Yes, I understand. Okay.
Yeah.
Okay,
So the new thing is the notice to Department of Health in the event an ACT is denied.
after involuntary commitment has been denied, yeah, okay.
Yeah,
Okay,
Right.
and then on HB 950, okay, we talked about that. I think we're okay on 950.
Yes.
And then
Yeah.
the next one on the agenda is 1594, and that's where that's where you have,
this is the big one.
that's where you've done the money ask?
Yes, those are where
Okay,
all the money is.
All right, so
That's where
let's-
we are right now.
So for the one that I'm lead on, let's go ahead and roll it till tomorrow at 2:30, if that's okay.
Yes.
Okay, in this room, 329.
Yeah.
Okay, and then I will,
And I will send over
CD1
a
to all
CD1
conferees.
to all conferees, including on the House side.
okay.
I know that's a lot. But we'll get that.
Okay,
Are
so
we-
what,
Yeah, and then we're done with that? Can we open on, are we
Yeah,
done?
I thought you did.
Okay, now we're opening on Senate Bill 1594 relating to crisis intervention.
Okay, I'm opening.
Go ahead.
It's a Senate bill. So SB 1594 relating to crisis intervention. For the Senate, we have myself as chair, Senator Lee as co-chair, and Senator Moriwaki as member. For the House,
Actually, anything on this,
myself,
you can just-
Representative Takinouchi is co-chair, Representatives Amato and Garcia.
okay, so SB 1594 is where we are putting in most of our monies. It is a bill relating to crisis intervention. It basically has expanded from the previous bill to allow for the continuum of crisis interventions from the time of pickup to the time of, emergency crisis intervention and into time of stability. So because of that, we're looking at over $17,539,182. 2 FTEs to the judiciary for law clerks, and those total 68,566 for fiscal year '24, fiscal year '25, 71,000. And for Department of Health, the big asks are the 24-hour crisis bed on Oahu of 6,500,000, a neighbor island crisis shelter of 3 million, additional crisis intervention services stabilization beds. That's the second part after the crisis, which is 7,700,000 for 30 stabilization beds, because we are looking at upon crisis and assessments to be able to stabilize them for more than 1 week. And of course, we have the education part, which is $99,800 for fiscal years '24 and '25, where Department of Health wants to ensure that everyone involved, the officer and everyone who touches these homeless or behaviorally challenged people will be able to understand the continuum of what we intend to do with these 4 bills, along with the existing structure. Is that your understanding too?
Can I add some clarification? But generally, yes, I believe that is a very good summary. I want to clarify for the members, particularly on the House side, in Senate Bill 1594, rather than put it into statute, what we've done is we've created the behavioral health crisis centers into a pilot program, authorizing the Department of Health to do 1 pilot program on Oahu and 1 on a neighbor island. Hence the fiscal ask of about 6.5 million and 3 million for those crisis centers. That will allow and enable the department to have flexibility to be able to run these crisis intervention 24-hour drop-off centers. And then what I would also add, Chair, I know that one of your members was very interested in making sure we also had that appropriation for the $300,000 for the training of law enforcement for mental health. So that's also in the bill.
Yes, which was originally in the SB 1594. That's remains.
And then there was also an ask for the data collection for that moved from Senate Bill 1492 into this measure.
For the money ask.
Yes, for the money ask.
The actual procedure of the data collection
Yes.
is in the prior
So-
bill that we referred to.
This was the chart of the priority ask that we had. Chair, I had helped prepare a CD1, so can
Yes.
I finalize the CD1 for the Senate bill and then pass it over to you tomorrow at 2:30 if we may be able to roll this over at 2:30?
Okay.
Is that
So, yeah,
okay?
we're rolling this over because we do not have WAM release at this time.
Okay.
So that would be April 26th at 2:30, room 329.
Yes.
Okay. Okay, so we're done, right?
I think
Are
we're
we-
good.
We are adjourned?
Yes, thank you. Convening our 3 p.m. agenda for our conference committee on April 25th, 2023. We are in conference room 329 with a series of health bills. Della Bolatti here, opening on House Bill 278 relating to health. This is our Alzheimer's bill. On the House side, we have co-chair Keela and managers Chun, Kobayashi, and Garcia. Senator?
Okay, Senate conferees are myself as chair, Senators Kanuha as co-chair, and Senator Moriwaki as a member.
Chair, having looked at this bill, we are very close. I have prepared a CD1, which I'm prepared to pass over across the table to you now for you and your members. Also, we have a CD1 for our members on this side. Kobayashi, I believe that's it. And essentially what this does is it takes this SD1, continues to have a blank amount, but this is for the public awareness campaign, right? Yep. Yes.
Yes.
And so I think we're really close. We're just waiting on the money appropriation amount, and that's all I have for you, Chair. Is that good?
Okay. So rolling over.
Yes, because this is a money bill. If we could roll it over instead of tomorrow, can we move it to Thursday at 3:30 p.m.? Is that okay?
3:30 p.m. Okay.
So Thursday,
3:30, yeah.
4/27, 3:30 p.m. in this room.
Okay. Thanks, Chair.
Wonderful, thank you. Second bill we have up is House Bill 872. This is the funding mechanism for Hawaii Healthy Aging Partnership. On my side, it's myself, co-chair Takenouchi, managers Ilagan, Nishimoto, and Garcia.
Okay, thank you very much, Chair. Senate conferees are myself as chair, and Senator DeQuoit as co-chair, and manager Senator Moriwaki.
Thank you. Again, this is something I think we're very close on. I have prepared proposed CD1 that essentially has the Senate draft proposal and a blank appropriation date and an effective date of July 1st, 2023. Passing this over to you, Senator.
Thank you very much. Received. Okay.
And similarly, if we could, and I will make sure these get to the chairs, to the other members of the House. If we could also roll this over to Thursday, April 27th, 3:30 p.m. in this room.
Yes.
Wonderful. Okay, the next one we have is House Bill 1255 relating to SPURBs for the West Maui Hospital and Medical Center. On my side, myself, co-chair Cochran. Representatives Amato and Garcia as managers.
Thank you very much. Senate conferees are myself as chair, co-chair Senator Konuha, and manager Moriwaki.
Senator, I'm sorry, I did not have a CD1 prepared on this, but I do have some verbal comments on what I would like to put in a proposed CD1. It would strike Section 5 in the current Senate draft, and this is the reference to, hold on, let me make sure I can read this correctly. This was the provision that would have had County of Maui serve as the guarantor of any debt service. So I had some communications that was of concern to some members on the council, as well as both members of the House Committee and the Senate. And so I want to propose a CD1 that will strike Section 5 and then insert an effective date.
Okay.
Okay?
And so Section 5 exists in both drafts, right?
Yes, it did exist
Okay.
in both drafts, but we got feedback that it was unnecessary and it might
Okay.
cause some unnecessary friction. We want this to be more like a standard SPURB
Okay.
for healthcare facilities that we have done numerous times.
Okay.
All right, so I will prepare that CD1 and I will get that to you and your members. Because this continues to be a money bill, can we also move this to Thursday, 3:30 p.m.? But I will endeavor to get that CD1 to you and your members before Thursday.
Okay, perfect, Chair. Thank you.
Okay, the next one up I have is House Bill 1300 relating to mental health. We have a memo, opening on that is myself, co-chair Chun, and Manager Garcia.
Okay, Senate conferees are myself and Senator Kyoko Lole and Shimbokuro as co-chairs.
Okay. Chair, on this one, we received a memo from DCCA generally agreeing with this. They had some concerns about making the effective date and having parts 2, 3, and 4 take effect on July 1st, 2025. They also made some recommendations that the appropriation clause be amended to read the appropriated sums for as may be necessary for 1 FTE, and that to make the appropriate updates to the professional and vocational licensing division's internal databases. If I may prepare a CD1 based upon the DCCA memo, will that be something agreeable to you?
We're open to that, pending the CD.
Yeah,
Of course.
okay. So if you let me do that, I can prepare that, and if we can also roll this over to Thursday, 3:30 p.m. in this room.
Okay, thank you, Chair. Okay, Senate bills are up next. Okay,
Yes.
Senate Bill 384, Senate Draft 1, House Draft 2, relating to access for disabled persons. Okay, Senate conferees are myself as chair and co-chair Senator Lee, Rhodes, and Inouye, and Manager Shimbukuro.
And on our side, it's myself, co-chairs Tarnas, Takenouchi, and managers Garcia.
Okay, thank you very much, Chair. For this one, we have prepped a CD that we have not received back yet. It's working off of the SD1. We're looking at a clean date of July 1st of this year. So basically, this bill just allows counties to adopt ordinances to enforce parking rules, specifically for persons with disabilities. And again, this is just enabling language, okay? So we don't have to worry about an unfunded mandate at this time.
Okay. Thank you, Chair. If we can see a CD1 on that.
Yep.
And I believe there is a finance and requirements on these as well.
I believe so, yes.
Okay.
So once we receive the CD, we'll be circulating that, Chair.
Okay. Can we roll this over to Thursday, 3:30 p.m. as well?
Yes.
Wonderful.
Okay, thank you. Okay, up next, Senate Bill 1016, Senate Draft 1, House Draft 1, relating to public-private partnerships for delivery of healthcare services. Senate conferees are myself as chair, Senator Kyoko Lole as co-chair, and Senator Moriwaki as a member.
Thank you, Chair. On our side, it's myself, Chair Sayama, Yamashita, and Manager Garcia.
Okay, thank you very much, Chair. So for this one, we're also working on a CD off of the SD1, okay? And we're looking at a clean date, again, of July 1st of this year. And that's pretty much it at this point in time. So we don't have a draft, but once we have it, we'll send it over to you.
Yes, and I think we're really close on this one as well.
Yep.
I think we're agreeable to the language. And essentially, members, and just to refresh everybody, this is just affecting Maui health systems. It does not change anything for any other HHSC entities, and it really just kind of opens up who that private entity can be, as well as when the renewal process is requiring HHS or Maui health systems to provide more information to us as a legislature.
So come back on Thursday, Chair?
I think so, very good.
All right. Same time,
Yes.
3:30 p.m. on Thursday. Okay, thank you very much. On to the last, Senate Bill 1370, Senate Draft 1, House Draft 1. Okay. Senate conferees are myself as chair, Senator Kyoko Lole as co-chair, and Manager Moriwaki.
And on our side, it's myself, co-chair Takenouchi, and managers Tam and Garcia.
Okay, thank you very much, Chair. So this one, we're also working on a CD currently in the works. So it'll reflect off of the SD with a clean date of July 1st of this year. Okay, and I believe The language, I think we're pretty close on this, right, Chair?
Yes, and also, we did receive a memo from Department of Health asking for an effective date of July 1st, 2023. So I think we're really close on this. We just need to wait to get clearance on our side from Finn, as this has a Finn approval, or Finn referral on our side.
Okay, so come back on Thursday, 3:30?
Perfect.
Okay. Thank you very much. We're adjourned.
Thank you.
Okay, it's Tuesday, April 25th. We're in conference room 329. 315 agenda for one Senate bill. Senate Bill 1378, Senate Draft 1, House Draft 1, relating to unlicensed care homes. Senate conferees are myself as chair and co-chairs, Senators Keokalole and Rhodes.
On my side, it's myself, co-chairs Nakashima, and managers Kobayashi, Lamasao, and Purek.
Yes. Okay, so Chair, so we do have a CD for you to consider. Okay, so basically the CD reflects the Senate Draft 1. I just want to just share that we flirted with the idea of lowering the burden of proof to negligently, but we have agreed to keep the status quo due to for a number of reasons, including some hiccups that may occur that can contribute to some of the unintended consequences for care homes and others.
We concur that the threshold should be knowingly. We also concur with the effective date. Chair, I think we can vote on this.
Okay,
Do you have everyone here for you?
we need, actually, we're good.
Yeah, just you two.
Yep.
Members?
Okay, you ready to vote? Good.
Oh,
Sorry. Okay. We're waiting for the judge here to come in.
we can wait. I love
Okay.
seeing my colleagues across the table, and this was an easy
Alright.
conference. Shall we just
Get recess.
recess? Senator, opening back up on.
Oh, yes. Yes, so reconvening on our 3:15 agenda for one bill, Senate Bill 1378, Senate Draft 1, House Draft 1. So we do have an agreement, I believe, Chair. Okay, can we proceed to vote?
Yes, please.
Okay. All right, Senate Bill 1378, recommendation is to pass as a CD1. Okay, I vote aye. Senator Keokolole.
Aye.
Senator Rhodes. Okay, thank you very much. And may I take the vote?
Yes, please.
Okay. Co-Chair Belatti.
Aye.
Co-Chair Nakashima. Yes. Okay, Representative Kobayashi. Representative Lamasal. Representative Pirik. Aye. Okay, thank you very much. We're adjourned.
We have a bill.
Yep. Thank you.
Good afternoon. Convening our conference committee. Today is April 25th, 2023. It's 3:30 p.m. and we're in conference room 329. Opening up first on House Bill 982, relating to funding for the Department of the Attorney General Tobacco Enforcement Unit. Here on the House side, it's myself as chair, co-chair Tarnas, co-chair Takenouchi, and managers La Chica and Garcia.
Okay, for the Senate, it's myself as chair, Shimabukuro and Senator Shimabukuro and Rhodes as co-chairs, and that's it.
Chair, we are in receipt of a memo from Department of Attorney General, essentially agreeing with your position, and we are in agreement with your position. We would just like to offer a CD1 that inserts an effective date of July 1st, 2023.
Okay, let's
The
make
amount,
sure- yeah.
the amount we have in there is acknowledging the 750,000. We do need fin clearance on this, but if we can pass the CD1 across to you, we do have it
Okay,
ready to go.
Sounds good. So SD to July 1, 2023 with 750,000.
Yeah, and I'm also giving copies to our members here. You can have mine, Terrence.
So we're rolling this over to tomorrow? When do you think you can get Finn, and I gotta get WAM released?
Can we just move this to Thursday at 2:30?
That will be at 27?
Yes. And,
Thanks.
yes, Thursday,
2:30,
yes.
329.
2:30. And because we have a combination of House bills and Senate bills, I'll ask my committee clerk to make sure that we have the reconvene notice filed for all of these.
Okay, thank you very much.
Okay.
Okay, for SB 975, SD 2, HD 3 relating to health, electronic smoking device, e-liquids, tobacco products tax. For the Senate, it's myself as chair, Senators Kyoho Kolole as co-chair, and Senator Rhodes as co-chair, and Senator Shimabukuro as member.
And on the House side, we have myself, Chair Tarnas, Co-Chair Yamashita, Managers La Chica and Garcia.
Okay, we're kind of far apart on this one. So we have a Department of Taxation memo. Do you have the same one? Where basically, they say they have no preference, but if we accept the SD version, we could have it effective January 1, 2024. Whereas the House version, because it creates a new tax category, which I'm not sure why you want to create a new tax category, won't be effective until 1 year later, in January 1, 2025. So, and I think we need to talk also about the amounts. So could you explain to us why we need a new tax category?
So, Chair, with your indulgence, we had a drafting error in, basically the version that we sent over to you would have created a double taxation. And so we have since fixed that up, and what I've done with your indulgence is I've prepared a CD1 that clarifies it and essentially creates a taxation system where the tobacco products remain at 70%, and then there's going to be another section specifically with a percentage of wholesale price for electronic smoking devices or e-liquids sold. I've had the CD1 prepared with the blank retail permit amounts as well as the blank percentage. So if we could use this as part of our discussion, I have copies for you.
So
and for all of our
we are
members.
talking about the 70% then?
I think we have it set up, the policy language here is to be able to set up a percentage of wholesale. And we need to have a conversation about what I think that percentage should be. So yes, I think we're primed to do that.
Okay, so I will look at your CD1, but like I said, Department of Taxation basically prefers SD1 because there is no new rate, there is no double taxation, and it's ready to go as of January 1, 2024. So why can't we just do it with the SD, the Senate version?
Well, I'm looking at the memo from Department of Taxation, Chair, and they're
Look at
actually.
the last paragraph.
I am looking at I'm looking at an April 25th memo from Department of Taxation, and they're
Yes.
asking an effective date of January 1st, 2025.
Only for the HD1 version or the HD2 and HD3. You look at the last paragraph, it says, if you accept the SD1 or the SD2, the department is able to implement it as of
Yeah.
January 1, 2024.
Yeah, and I believe.
It's because HD1, HD2 created a new tax category and created double taxation, whereas the Senate version did not.
And what the Senate Draft 1 and Senate Draft D2 do is to maintain a singular percentage. And so what the House position is that we want to look at a different percentage rate. To that end, Chair, I prepared some research from our staff that shows what other states' percentage rates are, and I wanted to share it with you and your members as well. So I made copies
So
for
what
all
are
of your
you-
members.
What are you proposing as a different, so you folks still at the retail rate of 70%, which matches the cigarettes, the tobacco rate, but you want a lower wholesale rate than tobacco? Is that the House position?
House position is we want to have a discussion about a percentage of the wholesale price.
And how much is that wholesale price, so that way we know that it's not a moving target that will change on us?
Okay, well, I think that's why I prepared this for you, Senator, and it shows the range of what other states have done in terms of proposed wholesale prices. Massachusetts has gone up as high as 75%, but you have states such as Georgia that have a combination of a 7% wholesale tax as well as a per liquid tax. House is not suggesting any per liquid taxation rate. We want to find a percentage wholesale price. And so if you want to take a look at the research that we've provided that shows the range and the types of taxes used in other states,
Okay,
I
just
think.
as a policy question, why is the House version different for tobacco for wholesale rate? Whereas the Senate version it is in parity with tobacco. I mean, I just want to know policy-wise, why is the House version for vape cheaper, a lower rate, or a different rate, or even a higher rate
I think
than
what-
that for tobacco, when we just want parity?
I think when you look at the different products, at cigarettes versus vaping products, we have different types of vaping products. So a 70% tax on cigarettes makes sense. It's easily applicable. But when you're looking again at the products of vape, right? You're talking, some states have wholesale prices on the vape devices. We're a 70% wholesale rate on the pods or the cartridges may be reasonable for the larger entities and may not be as reasonable for the smaller vape entities and places that we have out there. So what the House is trying to propose and to look at, and we don't have a percentage and we hope to have a conversation with you, Senator, is a reasonable rate that addresses and imposes a taxation on vape products.
Okay, so this is disappointing because one of the reasons why the Senate did not move the flavor ban was because we were looking at parity for tobacco and vape. And now that the flavor ban isn't being moved, it seems to me that the House has changed position from what it had passed previously, because it was very similar to the Senate version, except of course you guys double taxed it and created this new tax rate. So it's just disappointing. It's something that we could discuss more, but I just want to make sure that in the event that this bill dies, that the advocates are aware of the differences in the position. And the Senate position is we want parity with cigarettes, with tobacco.
That's fair. And I
Okay.
think we're not there. We want, what the House would like, Chair, is to come up with a reasonable taxation rate that recognizes the vaping products and the vaping, the different types of vaping products that are out there. When we look at the range of how other states have imposed different types of taxations, there's best practices that go beyond just imposing a wholesale price tax.
And again, Senate version is we want parity, that way we do not incentivize vaping for kids, and that's the reason why we want parity. And we're not only looking at tax, I'm hoping that what you provided us does not only show the taxation rate, but also shows the consequences to see whether or not it actually, those with the lower rates, whether or not they've actually reduced or increased vaping because of the lower tax rate. And I'm hoping that that does not occur in the event we come up with a compromise position. Because like what happened with the vaping ban last session, the advocates were not happy with a compromise position. And that's the reason why we want parity this year. Okay.
Chair,
What
one other
time
thing
do we
that,
have?
Chair, one other thing that we have outstanding is we have to identify what is going to be the amount for the fee or the permit, because that's also an open question still in the bills.
Again, we want parity with tobacco on that. And I believe
Well, in
the
Senate Draft
Department
2,
of Taxation came up with amounts.
but in your Senate Draft 2, I believe you had a $50. I think the payment of a fee of $50,
Okay.
the retail tobacco permit, but I think DOTAX may be looking at $100.
Okay, I'm good with those tax.
Okay.
Okay,
So-
so when are we gonna come back? I think this is gonna take a while to discuss.
Yeah,
Thursday
I think Thursday at 2:30 would be good.
at 2:30, April 27th, 2:30,
Yes.
329.
Yes.
Okay, next up. Senate Bill 318 relating to fetal alcohol spectrum disorder. For the Senate, it's myself as chair. Senator Moriwaki is excused, and Senator. Oh, I'm sorry. Oh, my goodness, you're hiding behind Senator Inouye. And Senator Aquino is also present. For the House,
We have on our side, myself, co-chairs Takinouchi, managers Mizuno, and Garcia.
okay, so this is relating to fetal alcohol spectrum disorder, the pilot program and a public awareness campaign. And I believe I provided you with a proposed CD1 based on Department of Health proposed amendments.
I don't believe I have that.
Okay, let me,
No.
we CC'd everybody.
Uh,
Emailed, right? We emailed everybody. Proposed CD1. Well, I'm sorry. I apologize. Apparently, Department of Health recently changed the amount, so we're not, now it's $450,000, so we need to roll this over. And we also don't have Fin and WAM approval. Previously, they wanted $350,000.
So you're gonna prepare a
We'll
CD1,
provide a CD1 based upon the most recent Department of Health request of $450,000
and 35,000.
and $35,000.
Yeah, so the memo of April 24th.
Yeah. Are we good with that? And
Yes.
so can we roll this over to tomorrow?
Thursday, can we move this over to Thursday?
Everything Thursday?
Yeah.
2:30, 329. Okay. Next up, we have HB.
Okay, this is House Bill 948 relating to child and adolescent mental health. On our side, we have myself, Chairs Morikawa, and Managers Capella, Martin, and Garcia.
And for the Senate, it's myself as chair, Senator Kidani as co-chair, and Senator Moriwaki as member manager.
So we have prepared a CD1 based on the Senate Draft 2, so accepting your changes, Chair. We've left a blank appropriation amount.
Yes.
And I believe we're looking at approximately 1.78 million. And so here's the CD1 for you and your members. And I will have a CD1 with the blank appropriations.
And an effective date upon approval,
Not upon approval, I believe it's, this is fiscal, so July 1st,
July 1st.
2023. Garcia.
we also need, Fin and Wham approval on this one, so, but Thursday? We'll go
Yes,
over
Thursday.
2:30, Thursday, April 27th, 2:30 at room 329. Okay, HB, next one.
Okay, House Bill 1296, this is relating to early intervention services. On our side, I have myself and co-chair Takenouchi and managers Kila and Garcia.
Okay, and for myself, we have the Senate as I'm chair, and we have Senator Inouye as co-chair and Senator Shimabukuro as member manager.
So this is an early intervention services working group. Chair, we have received memos from Department of Health identifying a sum of $100,000. Also, in all of our fiscal bills, we'll be inserting that section about expenditure ceiling. And we are agreeable to the addition of EOEL to the working group membership. So if I can prepare a CD1, I can have this ready for you on Thursday at 2:30 p.m.
Okay, and I think we also wanted a, yeah, that's fine, EOEL, I
Yeah.
think it's the major difference. Yes, that's fine.
All right, so
Okay.
if we can roll this over till Thursday at 2:30 p.m. in this room. Okay, next bill up is House Bill 1296, Early Intervention Services. On our side, we have myself, co-chair Takenouchi. I'm sorry, I'm reading the wrong one.
Yeah,
Myself, co-chair Takenouchi, managers Amato and Garcia.
Kila and Garcia. 1296,
No, we did 1296.
we did, I'm sorry.
1296 was the Early Intervention Services Working
right,
Group.
I'm
We just
sorry.
did that. So now we are on House Bill 1263.
Okay,
Rela-
sorry, you're right. So for for the Senate, it's myself as chair, and Senator Moriwaki as co-chair, and Senator Shimabukuro as member manager. This is the relating to Hawaii Able Savings Program.
Okay. Chair, we have an email from DD, from Ms. Bartoldes. She has proposed and given us language that would strike out Section 4 from the SD2, that was the additional incentive payments. And then in Section 5, appropriate the funds not from the Hawaii Able Savings Program Trust Fund, but from the general revenues. My suggestion is that if you may, indulge me if I prepare a CD1 based off of these latest amendments, but this captures the language that will hopefully make the Able Savings Program more user-friendly and effective. So if I might be able to prepare a CD1 and float that over to you by Thursday.
Okay, and I just want to make sure you got the same email. My email does not have any monies amounts to fill in the blanks with.
I don't have that appropriation amount either yet.
So we don't have, okay, I'm okay with you preparing blank amounts for CD1.
And maybe by Thursday, we can also see what that amount is that they would like from the general revenues.
Okay, April 27th, Thursday, 2:30 p.m.,
Yep.
329. Okay, thank you. The next one is HB again.
Okay, House Bill 1340, this is relating to mental health. This is the Temporary Breakthrough Therapy Designation Advisory Council. On our side, it's myself, co-chairs Nakashima and Kitagawa, and manager Garcia.
And for the Senate, it's myself as chair, Senator Lee as Senator Lee as co-chair, I see him here, and Senator Shimabukuro as member manager. Why don't you folks just accept Senate version? It's effective upon approval.
Yeah, we don't have agreement, so I'll have to look further into this, but do you want to roll this over because this is has a fin referral on our side? If we can move this to Thursday?
Okay, because the language is very similar.
I think it is. Do you guys shift this over to,
Office of Wellness and Resiliency.
oh, I think that's the concern we have. that it be shifted to the Office of Wellness and Resiliency. Because in another bill we have moving, we're moving the Office of Wellness and Resiliency to Department of Human Services. So the reason why we had wanted the advisory council in the Department of Health is because the subject matter is more present in Department of Health than in Department of Human Services. So I think that was the open question for us.
We'll talk.
Okay.
April 27th. So that's basically the gist then, is the Office of Wellness versus
Department of Health.
Health and Health. That's fine. Okay, next one is SB 63, SD 2HD3, relating to nurses. For the Senate, it's myself as chair, Senator Keohoko Kolole, and Senator Shimabukuro as co-chairs.
On our side, it's myself, co-chair Sayama, Takenouchi, and managers Nishi and Perek.
Okay, this one, I believe we have an agreement.
White members don't have copies of the CD1. I was given the copies of the CD1. Do we have copies for our members?
Okay, the only problem is, I think with this with the latest memo, they actually want money of $67,000. So CD1 isn't, we need to have an appropriation language.
Okay, so are you gonna,
Yeah, we need to roll this over.
Okay,
To get
so-
RAM and fin release. April 27th, 2:30. Because I think we had an agreement with no appropriation, but the latest memo says they want $67,000.
is the memo from,
I saw them for $67,000.
okay, so can we, track that down?
DCCA. 63,000, yeah. DCCA, insert appropriation amounts, it just came out. And they want an effective date of July 1, 2022.
Okay, so should we roll this over to,
Thursday.
and then you'll prepare a CD?
I'll prepare a CD1 with the amount of $67,876. Compared to the million, that seems pretty cheap. Anyway, okay, so I'm gonna put in an appropriation and expenditure soon. Okay, next one is SB 599. Okay, relating to health, respiratory therapist supervision, physician assistants, advanced practice registered nurses. For the Senate, it's myself as chair, Senator Keohoko Kolole as co-chair, and Senator Shimabukuro as member manager.
And on the House side, we have myself, co-chairs Nakashima and Takenouchi, and managers Perek.
Okay, so for this one, there's no appropriation, but we still need fin and WAM release. We sent over CD1 with a effective date, because that's the only change.
Do you have copies
difference.
for my members? I believe you sent it to my office, but do you have copies
Yes.
for my members?
Yes, I sent it out to everybody
Did you
by
guys
email.
receive it?
Didn't we send it out? Everyone has it by email. Well, we gotta roll it over anyway because we don't have fin and WAM release. But please look at your emails for the CD1. Okay, of SB 599. Okay, roll it over to Thursday. Because this. Okay, SB 900. Oh, excuse me, SB 674, relating to interstate medical licensure compact for the Senate. It is myself as chair, Senator Keohoko Kolole as co-chair, and that's it.
Okay, and on our House side, we have myself, co-chairs Sayama and Takenouchi, and manager Perek.
Okay, this one I've also sent in a proposed CD1, but I need to change the proposed CD1, and because I got a late email, I think yesterday or today, from DCCA requesting an appropriation amount of $75,000. Did you get that same memo?
I have a memo from DCCA requesting the funds of $316,178 from, out of
316.
general funds into section 3. So it's a memo dated April 24th.
316,000 is what you got?
Out of general funds into section 3, and then clarification that the division will use this funding for a certain number of positions.
Okay,
And they're
the one-
requesting a delayed implementation date of at least 2 years.
Okay, from the Hawaii Medical Board, I got 73,406 for one position, 67,876 for another position. And according to Hawaii Medical Board, DCCA only needed 75,000, so it's something we need to talk about. Huge difference between both memos. I don't know, I don't see your 316,000 memo. The one I got has it broken down for the 2 salaries and $75,000 to DCCA.
I would also like to examine whether or not we really do need a delayed implementation date of 2 years. This is a serious, we have a serious workforce shortage. And I think in our earlier versions, we had actually wanted them to do it within a year. But if we could, since we have to take a look at all of this and all these monies moving, if we can,
April 27th. And I have
yeah, come back on this
CPN
one.
chair who will go talk to DCCA hopefully and find out why we need a delayed implementation. And you have CPC, no, you don't have CPC chair there. Okay, for SB 900, it is, so we're rolling it over to April 27th, 2:30 at room 329.
And you will be the one preparing the
Yes.
CD1 for that one, okay.
Okay, so for SB 900 SD2 HD2, relating to Hawaii State Health Insurance Assistance Program, I have myself as chair. Senator Moriwaki is gone, but I have co-chair member manager Senator Aquino.
And on our side, we have myself, co-chair Takeno Uchi, and managers Kobayashi and Garcia.
Okay, for this one, we need the appropriation, I just received the appropriation request yesterday of $186,288 for 2023 and $192,408 for 2024, and an effective date of July 1, 2023. Did you get the same memo?
This is from Ms. Cotterell, April
Yes.
24th. Yes, I think we should just if you can do a CD1
Okay.
with the blank appropriation amounts, and then we can pass this memo along to finance, but
I think the main difference is basically the preamble section. Well, you guys broke down. We can talk about that. It's more style over substance. Okay, April 27th at 2:30,
yep.
329. Okay, and we are adjourned. Thank you, folks.
Thank you. convening our 4 PM conference committee. This is April 25th, 2023. We're in conference room 329. First up, House Bill 218 relating to prescription drugs. This is the labeling bill for the Deaf and Blind Task Force. On our side, it's myself and co-chair Nakashima and managers Amato and Purick.
And for the Senate, it's Senator Shimabukuro chair, Gail Golole co-chair, and Kino member.
Chair, we've looked at the version of this and we are agreeable to the amendments made by the Senate. So I have had a CD1 prepared that essentially takes the SD draft and then puts on a effective date of July 1st, 2023. I apologize, I did not have CD1s prepared for everyone here, but if you
I'm
can trust me,
agreeable.
you're
Yes,
agreeable?
I'm agreeable.
Okay, can we take a vote then on this?
Sure.
With the proposed CD1.
Yes.
So recommendation of the House and Senate managers is to pass with amendments. On the House side, I vote aye. Chair Nakashima?
Yes.
Manager Amato?
Aye.
And Manager Purick is excused. Do we have quorum? Yes, we do, I believe. Yes. May I take the vote for you?
Sure.
Chair Shimabukuro.
Aye.
Chair Keo Kolole.
Aye.
And Member Aquino?
Aye.
We have a bill.
Yay!
Yay!
Right.
And it is 409.
Okay. Okay, very good.
Wait, let me
Oh,
get
yeah,
this
go
to
ahead.
you.
Thank you. Okay. All right, thank you. Okay, you ready for the next one?
Yes.
Okay, so moving on, SB 473, practice of pharmacy. And for the Senate, we've got Senator Shimabukuro chair, Kyoko Lily co-chair, Moriwaki member.
And on the House side, we have myself, co-chair Nakashima, managers Takino Uchi and Purick.
And similarly, as what you just stated, we are ready to, we agree with the House amendments to the bill, and we just need to make a clean date. However, we just need to wait for an SMA to make a final legal check to make sure it's going to be okay. So can we, and the CD1 they're working on, that we'll get out to you folks. And so can we roll this to, I guess maybe tomorrow, same time? Or is
Actually-
tomorrow be earlier?
Oh, this is a
What's the time
CPC,
frame?
so we should get this.
Yeah, there's no Fin and Wham, which is nice. Or we could even make it, I know you have another agenda tomorrow at 2:30, or no, yes, Thursday, yeah, Thursday at 2:30. It's Wednesday, we can go earlier, actually earlier would be better for me.
I know, I think so earlier as
Would be
well.
better for me,
Do I have 3 o'clock available? Yes, let's make this at 3 o'clock. If
3
we can
o'clock?
roll this to 3.
3, is that okay? Okay, okay. So April 26th, 3 PM, room 329.
Yes, and I do want to acknowledge that we did receive a memo in opposition from the Board of Pharmacy, but I would say that the work that we've done on this has ensured that there's enough protections, and this is really looking at a very kind of specific class of dialysis medications that has the safeguards already in place. So I do want to acknowledge that we received it, but I think we have done the due diligence to ensure that there are safeguards.
Thank you, yes, thank you for acknowledging that. Yes, I agree. Okay, then the last bill on this agenda is SB 759. This is relating to health, and for the Senate, it's Shimabukuro chair, Inouye co-chair, and Aquino member.
And on the House side, it's myself, co-chair Takeno Uchi, managers Amato and Morikawa.
Okay. And similarly to this bill, we are, actually, we're pretty much, both sides are in agreement on the language for this bill, so there's really no substantive changes that I foresee need to be made, except for making a clean date, and then getting WHAM and FIN release, of course.
Yes, and I believe that the ask is for 1 permanent full-time position and 200,000 appropriation.
Okay.
So that's the memo of April 24th. Did you want to prepare a CD1 to that effect?
Yes, yes, actually, we're working on a CD1. And we'll do a memo as well for us to jointly submit to the money committees. Do you want to just put on the same agenda, since we're already meeting tomorrow? Or what do you think?
I think that's fine, but I don't know that we're gonna have any money
Yeah,
by
I don't
then.
know, yeah.
Let's just keep these two together
I
since,
guess we might as well.
Yeah.
Yes, we're seeing it anyway, so.
okay,
So April 26th, 3 PM?
tomorrow.
Yeah, tomorrow, 3 PM, just in case. Okay, so I think that's, 3 PM, 3 PM tomorrow. Okay, seeing nothing else, then we are adjourned.
All right,
right,
thank
thank
you.
you.
Thank you, Chair.
Aloha, welcome to the Conference Committee, Tuesday, April 25th, 2023, 4:30 PM. Conference Room 329, one measure between the conference committees, SB 894, SD2, HD2, relating to the Office of Wellness and Resilience. On behalf of the Senate, myself as chair, co-chair Shimabukuro and Kidani, managers Aquino and Awa. And Kidani, Aquino, and Awa are excused.
Thank you, Chair McKelvey. On the House side, you've got Mizuno, Bellotti, Kobayashi as your co-chairs, and we've got Representatives Amato and Garcia as your managers.
Okay, thank you. You got a full deck, it looks like, almost over there. How you doing, man? Okay, we've been talking story about this, and I think that in our conversations, we kind of decided to go with the conference draft 1 based upon the last iteration of the measure, with the main ones being changes, I guess, being is we're going to go back to the Senate position of advisory instead of
Yes, that's my
advocacy.
understanding.
And then we're also, more of a technical thing, we're just going to go ahead and make it corrections and Director of Corrections and Rehabilitation instead of Public Safety, because January 1st, they will be known by that name. And with a clean date, I believe, the measure, there's a, we're extending it to 7/1/2025 and 6/30/2025, and of course, January 1st, 2024 will be the effective date, which will reconcile it with the other changes.
Right, really appreciate you taking the majority of it, the latest House position, Chair McKelvey. Would it be okay if we pass out to the
Well,
House
actually, we have the
conferees?
CD1 that we prepared for you guys, a draft. You should have gotten a copy already, so here
We
you
did.
go. Your
No,
members-
I got a copy. So
Okay.
we're going to make sure our members get a copy of it. Again, thank you for considering the latest House draft 2, and also for changing it to advisory board rather than advocacy board.
Well, that was the Senate position, so we appreciate going back to that. But
We did get clarification from the executive office, from the Office on Wellness and Resilience, so you are correct.
okay, so
That's-
we're all good. So let's memo our money committees.
Oh, let me ask, members, are you guys, okay, you guys got any questions? Okay, Chair, I think we're good. We need our money committees to
We need
release.
We have to release, exactly. We have agreement on the CD1 across the table, so why don't we go ahead and we can memo our money committees and let's get together, reconvene. Do you want to say, for expediency's sake, that we can try to come back tomorrow at this time? You think we'll get
Yeah.
a release by then?
You never know. If they finish the budget tonight, they might start releasing bills as early as tomorrow, so.
That's true. Okay,
Shall
so
we
why
go
don't
Wednesday?
say the same time here, which will be 4:30 PM, conference room 329.
April 26th.
Actually, is it okay if we could, is 4 o'clock okay by any chance?
I got an agreement with Chair Bellotti. I got the room from 4:30 to 5.
Okay, got it. Okay, so 4:30 will be.
Yeah, is that cool?
That works.
Okay, 4:30, April 26th, in room 329.
Okay, sounds good.
Reconvene. Hey, thank you very much,
Perfect.
Chair.
Okay, thank you.
Good afternoon, Tuesday, April 25th, 2023, a little after 4:45 PM at the State Capitol Conference Room 329. We're here for two bills, House Bill 579 and House Bill 870. First up is House Bill 579 for the House. You've got Mizuno, Tarnas, Kitagawa as your co-chairs. We've got managers Representative Amato, Ichiyama, and Garcia.
Okay, for the Senate, it's myself as chair, and co-chair Senators Rhodes and Kidani.
Thank you very much, Chair San Buenaventura. Can I, with your kind indulgence, turn it over to Representative Ichiyama to explain the CD1, proposed CD1. Representative Ichiyama?
Thank you, Chair Mizuno. So the proposed CD1 basically deletes some unnecessary language from the preamble. It also takes out some of the reporting requirements that were duplicative that were put in the House draft, but they can be taken out. And we ran these amendments by the Attorney General's office, and they're okay with it.
Do you have an email saying that they're okay with your proposed CD1?
I do not. I was told verbally by AG Lopez, but I'm happy to get an email from her.
That would be good.
Okay, can do. Sure.
Okay, we're not prepared to agree at this time because you just handed us proposed CD1. So when do you want to roll it over?
Yeah, plus we need the money committees to release. Hey, Chair, can we roll this over to tomorrow, April 26th, same time, 4:45 PM, same room, conference room 329, if it's okay?
Yes. Okay, and Representative Ichiyama, since Chair Mizuno is deferring to you as chair for this bill, when you ask AG Lopez for that confirmation, can you also get confirmation from her that she is not requesting any monies, not now or ever? No, because that's the reason why it had failed previously, was because the House chair was concerned that it would be an unfunded liability that Attorney General, a new Attorney General would ask for monies because it would be an unfunded mandate. So we just want to confirm, because she confirmed with me orally that she would never ask for money for this.
I'll do my best, Chair San Buenaventura.
But, okay, thank you.
Okay, thanks, conferees.
Thank you.
Thank you, Chair. Okay, Chair, next bill on the agenda is House Bill 870, House Draft 2. Senate Draft 1 for the House. You've got Mizuno, Kobayashi as your co-chairs. We've got managers Representative Amato and Garcia.
Okay, and for the Senate, it's myself as chair, Senator DeCourt as co-chair, and member Senator Shimabukuro.
Thank you very much. We relied a lot on, we appreciate what the Senate has done. We relied a lot on our introducer of the bill, our colleague, Senator San Buenaventura. If I may, I'd like to turn it over to Representative Amato to give you information on the House's position based on our colleague, Representative Takayama. Representative Amato?
Thank you, Chair. It was an honor to work with Representative Takayama on this. So the Senate version has a similar and more detailed version of the purpose, which is well-written and agreeable. And so regarding the appropriation amount, having worked with Representative Takayama on this, the issue is that the House version requests $25,000, whereas the Senate version is requesting $100,000. After conversations with the bill author, we suggest that the CD1 should appropriate $25,000 to do a study and then report back on the actual cost to implement the pilot program 20 days prior to the convening of the next session. Thank you, Chair.
Thank you so much, Representative Amato. We did not do a CD1. We want to see what the Senate conferees want to do, and hopefully we can find some compromise here.
Okay, so it doesn't, we're gonna need to have WAM released anyway.
Right.
April 20, come back tomorrow?
Yes, can we roll this also April 26th, 4:45 PM, room 329?
My question is, I don't know where the monies came from. Where did the figure come from of the $25,000?
I believe Takayama had requested 25,000. He thought it was more doable if we just did a study rather than pilot. I believe in a pilot. I think we should have a pilot, but I think we don't want to do an unfunded mandate where DHS comes back and says, we just don't have enough. we want to do this right.
Okay, so we will talk about it some more.
Okay, and we are open to,
Okay,
okay, thanks, Chair.
and we are adjourned, right?
Yes, thank you so much. Thank you, members. Thanks. Good afternoon, Tuesday, April 25th, 2023. A little after 4:55 p.m., we're at the State Capitol Conference Room 329 on House Bill 961, House Draft 1, Senate Draft 2. For the House, you've got Mizuno, Woodson, Kitagawa as your co-chairs. We've got Representatives Amato, Martin, and Matsumoto as our managers. Senator?
Thank you. And for the Senate, myself, Kidani as chair, Senator Wakai co-chair, and Kanuha member.
Thank you very much. I wanted to thank you, Senator Kidani, as well as Representative Woodson for working on early education all these years. My understanding is that we're getting close to a CD1 proposed. We should have it by tomorrow morning. Yes. So, Senator, if it's okay, could we reconvene for tomorrow, April
Okay,
26th?
Can you give me what the CD1 is going to entail?
Yes.
My understanding is it to effect the date upon approval.
I'm gonna
And ask for
turn-
40 million each in fiscal years 24 and 25.
Yes, Chair Woodson, please.
If I may, Chair, thank you. Thank you, Senator, for the question. And so basically, the CD1 will reflect the SD2. We stripped out the appropriation language because we included the budgetary ask in the budget, and it expands the early learning opportunities for 3 and 4-year-olds in the pre-K program and also preschool open doors. And lastly, we extend the implementation date for preschool open doors to January 1st of 2024. Those are the major changes as it stands right now.
Okay, so it's not upon approval then?
And it's a clean date, yes.
Okay, thank you. So roll over to when?
Yes, Senator, if we can, tomorrow, April 26th, same time, 4:45 PM.
4:55 or 4:45?
Oh, we can, should we go 4:40?
That's what we did today.
55? Okay, sorry about that. 4:55, Senator, PM. Conference room 329. Again, that's April 26th, tomorrow. Thank you, Senator.
Thank you.
Senate Humphreys. Thanks, House Humphreys.